A very warm welcome to the 7th module of Breastfeeding Training Program. Today's session is on lactation counseling and confidence building in mothers. I am Dr. Anjali S Raj, Senior Resident in Department of Neonatology at St. John's Medical College and Hospital. The objectives of today's session would be to understand what is counseling, what are all the qualities needed for good counselor, the skills needed for effective counseling, the art of building confidence in mothers, and at the end, I would like to give you a small checklist called GALPAC. What is counseling? Counseling is a way of working with people in which you understand what they feel and help them to decide what to do. Here, the key words are understand and help them to decide. So, it is very important that you know what the actual problem is by attentively listening to them, and at the end, with the help of your knowledge, you help them to decide the right thing to do and do not imply your own thoughts on them. As you can see over here, this is definitely not counseling. Here, it should not be like one person is constantly talking and the other person is just listening. Counseling should be more of listening and less of talking. Now, once you have understood what is counseling, why is breastfeeding counseling needed? By this time, you've already known that breastfeeding is very important for both the baby as well as the mother. Exclusive breastfeeding alone can reduce the neonatal mortality rate by 35%. Breastfeeding is not just mother's responsibility. Breastfeeding is a shared responsibility of mother, father, the whole of the family, and the community, which also includes the healthcare workers like us. Breastfeeding is a long-time process. It is not a one-time affair. A mother has to exclusively breastfeed for 6 months and should continue to feed for at least minimum of 2 years. This needs a lot of commitment. And for that, she needs constant motivation. Thus, breastfeeding counseling is very, very important. When do you think breastfeeding counseling should be done? Breastfeeding counseling should ideally be started in the antenatal period during their each visit to the obstetrician. And it should definitely be done just before the delivery. It should be done in the most vulnerable period, that is the immediate postpartum period, at the time of discharge counseling, and also during each immunization visit. How will a mother be post-delivery? Something like this. She is very confused whom to take care of, herself or her baby. She is in a lot of pain. She is very tired. She has undergone a lot. She is concerned whether she is doing the right thing, whether her baby is doing well or not. And she is very irritated with the baby constantly crying and lot of advices coming from all the places. She's definitely not in a good place. And this is the time when she actually needs a good counseling to breastfeed. What should be the qualities of that good counselor? A good counselor should be genuinely concerned. The person should not be judgmental. He or she should be a very good patient listener. They should have a positive attitude, so much so that the positive vibes should go to the mother. And they should be very flexible and not be very rigid in their attitudes. They should be very clear and accurate in their advices. And definitely, the most important thing would be being empathetic towards the mother. What are all the skills that are needed for good counseling? The good counselor should have an effective nonverbal communication, should ask open-ended questions, should be more actively listening and providing appropriate responses should reflect back to what mother says and should empathize her and feel what she actually feels and avoid the words that are judging. Let me tell you in brief about each of these skills. The first important skill would be the effective nonverbal communication. What is nonverbal communication? When you try to put your thoughts or when you imply yourself more with your gestures, more with your body language and attitude, and not with your words, that is called nonverbal communication. How to make it effective? Effectively, how you can do is by keeping your head at the same level, by maintaining a good body language and posture, which implies that you are genuinely concerned about the person, for example, by leaning forward, by making a good eye contact, not just with the mother, but all the family members, which implies that you actually respect each of their views, and paying good attention and showing genuine interest and expressing your emotions appropriately. For example, being sad on hearing the struggles of the mother, holding her hands, touching appropriately, patting on the shoulder, giving a shoulder to cry. All these are good non-verbal communication. Definitely, you should not be monotonous. Doing good voice modulations will also help you to emphasize on those words which you think the parents or the mother should definitely imbibe. And you should remove all the barriers, for example, mobiles, paper, pen, etc., because these all distract the communication and will not help you to give your thoughts or put yourself forward better. The next important skill would be asking open-ended questions. When open-ended questions are asked, then the person will be able to describe the problem better and will be able to tell you or give you more and more information. However, when a closed question is asked, it is more targeted and you will just get simple or small information which mostly you intend to get. So, how are open-ended questions framed? Like, for example, how does that make you feel? Can you give me one more example? Can you describe that for me? How did you breastfeed yesterday? Why didn't you sleep yesterday? Tell me more about your problems. So, when you frame questions like this, the mother would be able to open up to you much better and give you more relevant information. However, when you ask closed questions like, are you able to breastfeed? The answer would be, yes, I'm able to breastfeed. Did he pass urine yesterday? Yeah, he passed urine. Does she sleep in the night? No, she doesn't sleep. So here when you see, most of the answers are very targeted in the form of yes or no. So this won't serve the purpose. But when the same questions are framed a little differently, like, how did you breastfeed yesterday? Oh, he did not do well. What was he doing in between the fields? And why are you feeling very low today? So when you ask such questions, mother would be able to open up to you much, much better. So try to have a conversation which has more of open-ended questions rather than closed questions. The next skill would be attentive listening. There are various types of listening. The first one is completely ignoring. The next one is pretending, wherein you pretend that you are listening, but actually you're not. The third one is selective listening. You only listen to those words or parts of the conversation which you want to listen. The last one, or the ideal one, would be the attentive listening. A counselor should actually be a good and attentive listener. For that, he has to be very patient. Once he has listened to everything, then he or she should evaluate what is the most pressing problem of the person. Then, do not be in a hurry to advise quickly. Take your time and analyze the issue and never be judgmental. Empathize the mother, have a positive attitude, as I said before, ask right, open ended questions, and at the end, do paraphrase. The fourth important skill would be reflecting back. For example, if a mother says, my mother says that I don't have enough milk, then we can say, oh, she says that you don't have good milk supply. My baby is passing a lot of stools, almost 8 to 10 times per day. Oh, is he passing many stools each day? When you reflect back, it shows that you're not only acknowledging her problem, it also gives her a lot of confidence to open up to you. So, this is a very important skill. The fifth skill would be empathizing the mother. Say, for example, the mother says, my baby wants to feed so often at the night. I feel so exhausted. Then you can say, oh, you really look tired with your night feeding sessions. My nipples are so painful that I want to bottle feed. When she says so, you can say, oh, that doesn't sound good at all. Is it hurting a lot? My breast milk looks so thin. It doesn't look good at all. Oh, are you worried about how your breast milk looks? When you empathize her or feel what she's actually feeling or understand her feeling, she will be able to open up to you better and will be able to also acknowledge to your responses better. The last skill would be to avoid words that sound very judging. For example, don't use phrases like or words like, oh, you're not doing a good job. You should try to feed much better. This is a correct position, but what you are doing prior to that was not right at all. This is not right. Do you think you have adequate milk? I don't think your baby is satisfied with what you're feeding. Yesterday you were able to successfully feed. Today I think you have failed her. He feels very unhappy. Is he always fuzzy like this? When you use such words, which are very judging, mothers will become more concerned and they may start doubting what they are actually doing. So try to avoid such judging words. The next talk would be on confidence building in mother. I feel breastfeeding is more like a mind game. Where there is a will, there is a way. So, if a mother confidently and positively embraces breastfeeding, then she'll definitely be able to do it for longer. So, how to do or how to build confidence in her? It is very important that she has confidence in you before you build her confidence. So, for that, here are a few tips. The first thing would be accept what a mother feels or thinks. The next would be recognize during the conversation anything that she says and please praise her for what she and the baby are doing right. This will keep her motivated, and if she feels that you are actually acknowledging it, she will do it more and more better. Give practical help. Mother doesn't need theory. If she says, I don't think so, this position is working for me, then you can practically show her what are all the various positions and help her to feed better. Give a little and relevant information. Use simple, plain language and avoid medical jargon. And make just one or two suggestions and never be commanding or authoritative. All these things will help you build good confidence in the mother and she will be able to lactate or breastfeed better. At the end, I would like to give you a simple checklist called GALPAC. GALPAC is a checklist or a mnemonic. When used properly, it will have all the components of the skills of good counseling that we actually talked about. The first thing would be greet the mother, introduce yourself, talk to her by using her name. When you use her name and speak to her, she will feel that you are her own, and she will be able to relate to you better. Ask her questions, open ended questions, as I said before. Listen to her attentively, patiently, and with empathy. This will help her to give you a lot of information. During the conversation, evaluate what is the most pressing problem of hers and use every single opportunity to praise what she and her baby has done right. The last thing would be to advise her with no medical jargon and one or two suggestions, and don't be very commanding. And at the end, confirm or check whatever you have told her she has understood or not. So when you do use this GALPAC effectively, I am sure you will be able to counsel the mother better. Uh, I thanks a lot. Thank everyone for giving me this opportunity, and I hope that you will be effectively able to counsel better and help the mothers breastfeed more. Thank you.